The Talk About range of iBooks use multimedia to support understanding and expression. Titles cover topics such as stroke, aphasia, leaving hospital, goal setting, and swallowing. They can be found in the iBook store if you search for Aphasia Friendly. Today we're going to have a look at the Aspiration iBook. When we breathe, oxygen goes into our lungs. When we eat and drink, food goes into our stomach. This picture is from an X-ray called a videofluoroscopy. Videofluoroscopies help show if food and drink is being swallowed safely. This videofluoroscopy is of a normal swallow. The swallow is fast and cleared effectively down to the stomach. This videofluoroscopy shows someone with a poorly coordinated swallow who is aspirating his fluids into his airway. Aspiration pneumonia is caused by food or drink entering the lungs and causing infection. This chest X-ray shows a healthy lungs. The dark area is air. This chest X-ray shows someone with an aspiration pneumonia. The increased white area is a sign of infection. Discussion spaces can be used to help understanding and expression. This draw it space enables you to draw the route or ask your patient or client to show that they have understood about swallowing, breathing, and aspiration. This drag and drop space can show the same. Oxygen goes to the lungs. Food goes to the stomach, as does drink and medication. Someone with an impaired swallow may have food, drink, and even medication ending up in their lungs, where it does no good and can cause life-threatening pneumonia. Throughout the Talk About series of books, there are draw it spaces. These can be used to support conversation on the topic. Aspiration pneumonia can cause prolonged hospital stays, loss in strength for recovery, and even carries a risk of death. Antibiotics can be used to help manage chest infection, but they do not reduce the risk of aspiration. Aspiration pneumonia can be serious. Everybody's swallow is different, so you need to work out what's the best way of supporting yours. Speak to a swallowing specialist. You may discuss alternative routes of nutrition, such as an NG or PEG tube. You may decide on different consistencies of fluid and drink. Sometimes strategies such as a head tilt or chin tuck can help protect your airway and enable safe swallowing. Or swallowing exercises to improve strength and safety may be recommended. Some people decide to take a quality of life decision over eating and drinking and decide to continue eating and drinking even with the risk of aspiration pneumonia. These logit widgets can be used, screenshot and printed as a record of your client's understanding of the discussion. When we swallow, food goes into our stomach. When we breathe, air goes into the lungs. And when we aspirate, drink can go into the lungs, and food and medication. This consent form can be used by the client to mark which options they have agreed to. Again, it can be screenshot and printed for your records. The Talk About series of books are available from Apple's iBook store. Search for aphasia-friendly resources or talk about books.